Good afternoon, and thanks for joining us for Living Local, your lifestyle show for all things Charleston and beyond. I'm Ashley Meservey.
Medical Monday, sponsored by East Cooper Medical Center.
Joining us today, we have Dr. Christopher Robinson. He is a high-risk pregnancy specialist here at East Cooper Medical Center. Did I get that right?
That is correct.
I got it. I nailed it. All right, so thank you so much for being with us today. First off, let's just talk about high-risk pregnancy. I mean, is that a big issue that you see a lot? I mean, obviously, you're specializing in it.
Absolutely. So high-risk pregnancy is one of those things oftentimes a patient may not recognize that they have a condition that could affect their pregnancy. And so identification of a high-risk pregnancy is certainly important because there's lots of things we can do to reduce that risk. And sometimes you can even convert that risk to a routine risk pregnancy through early identification and planning.
So do you find that most people think it's age or their family history are the main things, right?
It's highly variable. Some people can easily identify age. So age is certainly the first thing that rises to the top of the list because people love to Google. You get online, you figure out, what are the things I need to be thinking. That is right, because the information, the value of information can be variable depending on what you're looking at. Sometimes it's a medical condition. So you already know there's something different about me. Maybe it's diabetes, maybe it's hypertension, maybe other conditions that you've been seeing a doctor before. So in other words, some of our patients come to us because they already have a physician seeing them for some medical condition that really needs to be optimized coming into their pregnancy.
So don't make any assumptions. Basically, you could come into your office and say, I have diabetes, but I got it under control. And so that might not put you in that high risk category necessarily, right? If they were just had a condition beforehand.
It's interesting. One of the things we focus on is pregnancy can affect the medical condition. So in other words, the medical condition can actually change as pregnancy is progressing because pregnancy has so many changes upon a person's body as they're beginning to develop that little baby from very early until late pregnancy. And it's really keeping up with those changes and keeping that medical condition under control that can reduce that risk substantially. And diabetes is an excellent example, but hypertension, lupus, autoimmune disease, things like that. But as you mentioned before, there are some conditions that I may just see you one time, like for instance, age. A person's concerned about what should I be doing different because I'm 40 and older, or maybe I'm 50 and older. And
really, you're seeing where people are coming in, good for them.
Yes,
waiting
exactly,
a little longer.
Exactly.
So it's no longer 35 is the sky's the limit.
That's right. That's
I like
right.
that.
I mean, I really
good for the women
think
out there, right?
We do see more people who are planning. They're getting their careers underway. They have other goals. And then pregnancy comes along later in life.
Good job, ladies.
That's
making
right.
it all happen. All right. So as far as though, if we're thinking about starting that process and everything, but we know we have some health conditions, how do we find you? How do we get to you?
It's a great question. So first of all, you establish early prenatal care. I think that's the most important thing you can do. So in other words, most women may already have an OBGYN that they have been seeing for their routine care. They go and see that person. Get your pregnancy diagnosed, get an evaluation. And one of the things that OBGYNs do is they identify what are the things in this pregnancy that are high risk. And if there is something identified that needs to be addressed, your OBGYN would then refer to us and we would see you as a patient.
So do you have any tips on how to make that visit the best we can make it as far as knowing our background and things like that? I'm assuming that information is very helpful.
It is. So in other words, one of the things to think about is what has been your life story? What things have you seen a doctor for in the past? What are the things, have you had surgeries in the past? Have there been any issues with miscarriage in the past? Do you take any special supplements or medications? I think that's critically important. A lot of us take things every day we put in our body, but we need to reevaluate. Are those things good for my baby? And
like a melatonin or something, right?
Exactly,
that could have an issue.
Exactly. But then at the same time, there are medications that some people are taking for a medical condition, say for heart, lung issues, that they should not stop. In other words, it's better for the baby to have those medications on board because a healthy mom equals a healthy baby.
So they don't need to just go off of them or make no Google or anything like that. They just need to come and see you, right?
That is exactly right.
All righty. Well, thanks again for being with us today.
Yes.
And for more information, you can head online to eastcoopermedctr.com.